Joining me now to react, Director of Metropolis Pain Medicine and author of Coronavirus Made Simple, Dr. Devi Nampiaparampil, and Congressman Buddy Carter, who's participating in Pfizer's vaccine trials. Good morning to you both.
Good morning.
Good morning.
Okay, so Congressman, got to ask you first, did you experience any side effects after taking the Pfizer vaccine?
Well, I appreciate you asking that because I've had 2 shots thus far. I had the first shot, then I had the booster shot. The first shot, I did not have anything except for a sore shoulder, of course. But the second go round, I did. I was lethargic. I had, I didn't run any fever, just a little bit, but I had a little bit of muscle pain. So I'm thinking maybe I did get the vaccine. You know, it's a double-blind study, so you don't know whether you get the placebo or the vaccine. But I'm thinking maybe I did.
Okay, interesting. Well, keep us updated on that front. Now, Dr. Devi, Pfizer just completed its safety review. They're now applying for FDA approval. Sounds like things are really moving. When can we expect to see this vaccine? Is it still April, or has that timeline moved up?
Well, the widespread distribution might still be the spring, but at least from what's out there, it looks like the FDA is going to review the data on December 8th, 9th, and 10th. So if it approves the data, then what will happen is that they'll start their emergency use distribution of the vaccine. So they've looked at 4 states, Texas, New Mexico, Rhode Island, and Tennessee, to start rolling out the vaccine. And basically in those areas, what they're going to do is try to rank people according to needs. So how vulnerable they are, whether they're first responders, whether they're healthcare providers, and basically get the vaccine to these populations so that they can be protected first. So for example, healthcare providers, you want them to have the vaccine first so they can treat others. And there are some logistical issues that also need to be looked at. For example, with this vaccine, there are 2 doses. So you have to make sure that whoever gets the first dose also gets a second dose afterwards. And second, that there are no logistical issues in terms of the temperature. Yeah. The Pfizer vaccine has to be stored at minus 94 degrees, which makes it much harder. It can't be in a regular freezer. So it's not that people in those states will get more of the vaccine or will get it before others. It's just that it can be used as a model for how to spread it to people, whether they're in cities or rural areas or different circumstances. So there's really a lot that has to be looked at in terms of how to get the vaccine out there.
Yeah, absolutely. And speaking of logistics, Congressman, what's the buzz on Capitol Hill? Are you confident that this will be a successful rollout when the time comes?
Oh, I am confident, and I think that most people are confident. It's unfortunate that we have some governors in the Northeast who are playing politics, and unfortunately that leads a lot of people to believe that it's not going to be a safe and effective vaccine. I can assure you, I'm very confident it will be safe and effective. In fact, I'm so confident that I'm putting my money where my mouth is, and I'm part of the clinical trials. So. I think it's unfortunate that they're playing politics like this, but at the same time, I think we're going to get it rolled out, and it's going to be good, and we're going to beat this virus. There's no question about that.
Oh, yeah, I sure hope so. We all certainly want that to happen. And the way to beat the virus is, of course, with this vaccine. Now, there are 2 options, the Moderna and the Pfizer vaccine. Dr. Devi, if given the option, which one should we take?
Well, I think we'd be lucky to get either one of them, especially given the safety and efficacy data that we have so far. But I think just logistically, the Moderna vaccine may be easier for people to roll out just because it doesn't require that minus 94 temperature. It can be stored in a regular freezer. So I think we're going to need both. I don't think people need to be picky about it at this point. But of course, we'll wait for more data to come in.
Yeah, absolutely. And, Congressman, in Pennsylvania, they just tightened their coronavirus restrictions. And one thing that they're requiring are people to wear masks even at home when there are people, members of other households in your own house. I mean, how do you feel about that? I know that there's even a constitutional argument against that being a legal thing that Pennsylvania lawmakers can do.
Well, certainly we believe in personal responsibility, and that's going to be the key. Look, we all know what we're supposed to do. We've been at this for a while now. We know we need to be washing our hands, watching our distance, and wearing our mask. All of us understand that. So, I don't think it necessarily has to be a government mandate to tell us that. We all should just make sure that we're following those 3 W's. As long as we're doing that, we're going to be fine.
Yeah, I sure hope so. Dr. Devi and Congressman and Dr. Buddy Carter, wearing 2 hats there. Thank you so much for coming on. We appreciate it.